Factitious disorder is a serious mental illness where individuals deceive others by acting as if they are sick. This behavior stems from a deep-seated need for attention and sympathy. Individuals with factitious disorder are aware they are fabricating symptoms, but often unaware of the underlying reasons. It can range from exaggerating minor symptoms to inducing life-threatening conditions. The motivation lies in assuming the sick role, craving the care and concern that comes with being ill. Recognizing the signs and symptoms can be the first step in getting individuals the help they need. Early intervention is essential in preventing potential harm to themselves and others. Factitious disorder is a mental illness, not a choice. Individuals suffering from this disorder deserve compassion and support as they navigate their path to recovery. Understanding factitious disorder is crucial for both healthcare professionals and the general public. Individuals with factitious disorder employ various methods to feign illness, from exaggerating existing symptoms to inducing new ones. Common techniques include exaggeration. A headache becomes a migraine. A cold becomes debilitating. Fabrication. Inventing symptoms like pain or fatigue. Manipulation. Altering medical tests. Contaminating samples or tampering with devices. Self-harm. Injecting harmful substances. Ingesting toxins or inflicting wounds. They often possess surprising medical knowledge, making their stories more convincing. This knowledge is gleaned from medical textbooks, online resources, and previous healthcare interactions. Their ability to mimic illness makes factitious disorder challenging to diagnose. Healthcare professionals must balance their duty to provide care with the possibility of being deceived. This deception can lead to unnecessary procedures, misdiagnosis, and harmful treatments. Individuals with factitious disorder are not trying to deceive for personal gain. Their motivation is not malicious, but driven by a psychological need for attention and care. This crucial distinction separates factitious disorder from malingering, which involves faking illness for external rewards. Understanding these methods is essential for accurate diagnosis and appropriate intervention. Individuals with factitious disorder present a complex array of symptoms and behaviors. Common signs include inconsistency between reported symptoms and medical findings. They may describe debilitating pain, yet tests reveal no underlying cause. A dramatic and inconsistent medical history is another red flag. Eagerness to undergo invasive procedures or receive potent medications, even when unnecessary, is common. They may embellish or invent complications to prolong their hospital stay. Their behavior often raises suspicions among healthcare professionals. They may be overly knowledgeable about medical terminology and procedures. Identifying these symptoms is crucial for early detection and intervention. A compassionate and understanding approach is essential for building trust and encouraging individuals to seek appropriate mental health support. Avoid accusatory language to prevent denial, anger, and escalation of deceptive behaviors. While both factitious disorder and malingering involve feigning illness, they stem from different motivations. In factitious disorder, the primary motivation is to assume the sick role for attention and care. The deception itself is the reward. Malingering involves fabricating or exaggerating symptoms for external gain, like insurance money or avoiding responsibilities. The distinction lies in the underlying motivation. Factitious disorder is driven by internal psychological needs. Malingering is driven by external incentives. This difference is crucial for accurate diagnosis and appropriate intervention. Individuals with factitious disorder may not be consciously aware of their motivations, making diagnosis challenging. Differentiating between these conditions requires careful observation and psychological evaluation. Understanding the motivations behind deceptive behavior is essential for developing effective treatment plans. Both conditions can have serious consequences, but the approach to treatment differs significantly. Factitious disorder imposed on another, previously known as Munchausen syndrome by proxy, involves a caregiver fabricating or exaggerating symptoms in another person, usually a child or dependent adult. Perpetrators often believe they are acting in the victim's best interest, but their actions stem from a need for attention and admiration. Victims are subjected to unnecessary medical procedures, invasive tests, and potentially harmful treatments. In some cases, perpetrators may deliberately induce illness through poisoning or other forms of abuse. The consequences for victims can be devastating, including long-term physical health problems and psychological trauma. Identifying and stopping FDIA is crucial for protecting vulnerable individuals. FDIA is a form of child or elder abuse, and reporting suspected cases to authorities is essential. Healthcare professionals play a crucial role in identifying and intervening in cases of FDIA. Recognizing signs of fabricated or induced illness is vital for protecting victims. Providing support and resources to victims and their families helps them heal from the trauma of FDIA. Understanding the dynamics of FDIA is essential for effective intervention. Protecting victims requires vigilance and a commitment to their well-being. Factitious disorder carries significant risks and complications for both the individual and those around them. Early identification and intervention are crucial to mitigate these risks. Serious medical complications can arise from unnecessary procedures, harmful medications, and self-inflicted injuries. These actions can lead to chronic pain, organ damage, and even death. Beyond physical risks, factitious disorder impacts mental and emotional well-being. The need for deception and fear of discovery lead to isolation, shame, and guilt. Relationships with family and friends often become strained. Individuals may experience anxiety, depression, and other co-occurring mental health disorders. Addressing underlying psychological issues is crucial for recovery. Mental health intervention typically involves cognitive behavioral therapy, CBT. CBT helps individuals identify and challenge distorted thoughts and beliefs. A compassionate and non-judgmental approach is essential for effective treatment. Understanding the importance of mental health intervention promotes a supportive environment for recovery. The exact causes of factitious disorder remain elusive, but a complex interplay of biological, psychological, and environmental factors contribute to its development. Abnormalities in brain regions responsible for emotional regulation and impulse control may play a role. Early childhood experiences of trauma, neglect, or attachment issues are often linked to the disorder. Individuals with significant emotional deprivation may develop a need for attention and validation through the sick role. Certain personality traits, such as histrionic or borderline personality disorder, increase the risk. Exposure to serious illness or medical settings during childhood can also contribute. These factors are not deterministic. Not everyone with these experiences will develop the disorder. Understanding potential causes helps healthcare professionals identify at-risk individuals. Early intervention can prevent the development or escalation of the disorder. Comprehensive understanding aids in developing effective prevention and treatment strategies. Navigating factitious disorder can be challenging, but resources and support are available. The first step is reaching out to a mental health professional for a comprehensive evaluation. Treatment typically involves cognitive behavioral therapy, CBT, to address distorted thoughts and beliefs. CBT equips individuals with coping mechanisms to manage stress and regulate emotions. Family therapy can address relational dynamics and establish healthy communication patterns. Organizations like the National Alliance on Mental Illness and the American Psychiatric Association provide valuable information and support. Seeking help is a sign of strength, not weakness. By reaching out, individuals take a crucial step toward understanding the disorder and living a healthier life. Support groups offer a sense of community and shared experiences. Resources and support are essential for recovery and well-being. Factitious disorder is a serious mental illness that demands our attention and compassion. Increasing awareness helps break down stigma and encourages individuals to seek help. Individuals with factitious disorder are not choosing to be deceptive. They grapple with deep-seated psychological distress. They deserve empathy, not judgment. A greater understanding creates a supportive environment for seeking help. Early detection and intervention mitigate potential risks and complications. Healthcare professionals, educators, and the public play a role in recognizing signs and symptoms. Factitious disorder is not a life sentence. With support and treatment, individuals can overcome challenges. Working together, we can raise awareness and promote understanding. Creating a compassionate world supports those affected by factitious disorder.